Without further ado, let's welcome Dr. Paula Ferrada.
Hello everyone, and welcome to the SURGICON podcast. I'm 𝐏𝐚𝐮, a sixth-year medical student at 𝐾𝐪𝐷𝑒𝐴 University of Medicine and Pharmacy in Bucharest, and this year's president of SURGICON. Joining me is 𝘍𝑒𝑛𝑖a Găvănescu, a fourth-year medical student, also at 𝐾𝐪𝐷𝑒𝐴 University of Medicine and Pharmacy, and the scientific vice president of SURGICON. Together, we'll be your hosts for today's episode. The International Surgical Congress for Students, SURGICON, is organized by students within the Romanian Student Society of Surgery and has now reached its 6th edition. This event brings together medical students from around the world to explore diverse surgical careers, delve into various specialties, and learn from some of the most renowned doctors in the field. I am now excited to introduce our guest, Dr. Paula Ferrada, a trailblazing surgeon, educator, and advocate who has not only transformed the world of trauma and acute care surgery, but has also broken barriers across many fields. Originally from Cali, Colombia, Dr. Ferrada began her career in media before becoming the first Colombian woman to graduate from a surgical specialty at Harvard. She now serves as the System and Division Chief of Trauma and Acute Care Surgery at the Innova Health System, and is also a professor at the University of Virginia. Dr. Ferrada is a global leader in trauma surgery and a passionate advocate for diversity and inclusion. She has mentored countless young surgeons, trained doctors, and led initiatives to empower underrepresented communities in medicine.
Today, we'll dive into her incredible journey, how she balances her roles as a surgeon, mentor, researcher, and advocate, and gain insight what the future holds for trauma surgery, education, and equity in healthcare. So get ready for an inspiring conversation with one of the most dynamic voices in medicine. Without further ado, let's welcome Dr. Paula Ferrada.
Thank you so much for that wonderful introduction, guys. I really appreciate being here. I'm honored.
Dr. Ferrada, you've had an impressive journey from Colombia to the United States, eventually becoming the first Colombian woman to graduate from a surgical subspecialty at Harvard. Can you share what motivated you to pursue surgery and what the transition was like moving from Colombia to the United States for training?
Yeah, so I was fortunate enough that my mom is a nurse, retired nurse, but she wasn't retired when I was little, and my dad is a trauma surgeon. And surgeons in Latin America, they're surgeons of the body, right? So there's no fellowship. There's way less fellowship now, better than before, but 20, 30 years ago, it wasn't that way. And so when they didn't have childcare, they used to bring me to the hospital. And then, so I grew up in the hospital. I grew up with the nurses. I grew up with the residents, with the students, with the doctors. And part of it, it was like helping out. And, I was scrubbing for the first time in the operating room when I was 12 years old. I think people that know me, that I'm a little intense, maybe a little bit less now that I'm older, but when I was younger, I'm sure that I was hard to be around too. And then the operating room nurse got tired of me asking about my dad, so just put me in scrubs and sent me to the operating room. And my dad was in the OR with a AAA, ruptured AAA, and the clamp moved from the aorta and the blood went into the spine. I was like, oh my God, this is amazing. I was 12. And I think that at that time, surgery chose me rather than the other way around. And then, I wanted to come to the United States, but I wasn't 100% sure, but it was a gap in my training in Colombia because there was a strike in the medical school that happens in Latin American countries, not in the United States. And during those 4 months, I came to the United States and I spent some time with David Feliciano, one of my mentors at Grady. And I saw how here in the United States, there's a CT scan, there's a helicopter, there's blood immediately. And I'm like, this place is amazing. So then I decided that I wanted to come back and do residency, but it seemed at that time almost impossible. So I started buying the books in English and reading in English and doing all that. And I think I'm not going to say it was easy. It was extremely difficult to actually get a spot in the United States. And I had to go through a lot of hardship. But I think if you really want it, I think life or God or the universe, however you want to call it, it aligns. If you're persistent and perseverant, it will happen. So after a lot of work and promises and all these craziness that happened in the time, I came to the United States in 2000. Started medical school from high school because that's the way that it's set up in Colombia in 1994. And I came to the United States in 2000, and I had to do research and work free and do a lot of stuff that right now I know is not 100% normal, but at the time I was just grateful for the opportunity. And then when I got the spot at the 𝘱𝘱𝑒𝑑𝑖𝑠 Deaconess, I was not thinking, oh, I'm going to be the first Colombian woman in Harvard. I was thinking thank you for giving me a spot, because I didn't come to the United States to work in McDonald's, right? So I needed to be a surgeon. And there was nothing else that I would love that much. I remember my dad asking me, hey, maybe internal medicine, maybe dermatology. And I'm like, not for me. I wanted to do surgery. And when I was in surgery, I used to think, oh, I'm going to do vascular fellowship and take trauma call for fun. I'm going to do transplant fellowship and take trauma call for fun. So I was like, you know what? I'm just going to do what I love for fun. Because as it is, it's an intense job, right? So you have to be happy. You're going to make, I think, whatever you do, surgery, medicine, or corporate or law, whatever you do, you're going to have to make a ton of sacrifices in time and, for yourself in order to be successful. So you might as well be in a place that you absolutely love, because in that way, sacrifices feel less taxing, right? Because you know that even though you're not sleeping, maybe you're not eating, maybe you're missing somebody's birthday, whatever, you have your north, you know where you're going. And that feeling, that passion fuels your dreams and allows you to get to the point.
Yes, that's really inspiring, and your thoughts about your passion also, they are really inspiring for us. You've mentioned that you trained before in Colombia and then you came to United States in 2000. What were some of the systemic differences in medical education that you encountered, or how did those differences shape your approach to both surgery and also education?
Huge differences. I think in Latin America, where I was at the time, was a very poor state hospital. So the patients were lucky that they had a physician, right? And there was too many traumas. Trauma was, I think everybody at that time in Colombia that was a surgeon, even if they did surgical oncology, they were trauma surgeons by default, because we had the cartels and we had the drug, that kind of stuff. So we were trauma. Everybody was trauma surgeons by default because of volume, right? So you learn how to put test tubes and do all this stuff way before your time, because there's nobody else that can do it. So that is the main difference in the United States. There's a lot of supervision. I'm not saying it's right or wrong. I'm just saying that was the setup, right? So when I came to the United States, interns were learning to put central lines, and I was in my 58th central line. Then as a technician, I think that gave me a leg up, right? As a technician. Now I was behind in research, because in Latin America, there's no protected time for research, right? So I was, I learned how to write in English, which was not easy, and still I think I write in Spanglish. I surround myself by people that help me with this, right? But I think learning how to write and things that make sense and not translating things all the time into my brain, I think that was the most difficult part. And also the formality, right? So at the deaconess, for example, you could not wear scrubs. You're expected to change in regular clothes from the OR to the clinic or to rounds. In Latin America, everybody's walking around with scrubs all the time. And I didn't think it was an issue at all. But it was it was told to me pretty early on in my training that was not acceptable. So I had to change behavior, change patterns of behavior, right? Also culturally, I think in Latin America, people are, if something is happening to you, everybody's there available to help. The culture is warm, so everybody's hugging people all the time. In the United States, people are more reserved. They don't ask you if they see you struggling. Not a lot of people ask you questions or want to get involved. Some people are uncomfortable, so with the warmth and the hugging and stuff. I think I think, I guess 24 years in this country, people either got used to me or stopped caring that much about how people think, about how I behave. Because, I think that there's a huge power of self-confidence and owning who you are, right? Authenticity is a huge weapon. You're not going to be very good at being anybody else, but you're going to be awesome at being yourself, right? So owning that, and I think that was a part that it was interesting for me, because I think me being an export from Colombia, sometimes you don't feel that you 100% belong, right? And anyway, I think that's what motivated me to come to the United States. I actually thought I was going to train in the United States and go back to Colombia to give back to my country. It just happens that surgical training is long. I ended up getting married and having a baby and blah, blah, blah. So now it's impossible for me to go back. But through the Pan American Trauma Society, I think I have kept that connection with Latin America strong. So I have the opportunity to give back, at least in education. Yeah.
So now that you've mentioned the Pan American Society of Traumatology, you've held numerous leadership positions, especially this one as president, and you have a deep passion for mentoring young surgeons. How do you approach mentorship, and what qualities do you believe are essential for a successful mentor?
Right, that's a great question. I think that we in surgery and in medicine don't emphasize enough the importance of mentoring, of sponsoring, helping each other. I think that helping people should not be a strategy. Helping people should be a way of life, right? Kindness should be a way of life, not a strategy. If we could basically measure people not because of the checks that they had in the civil publications, but measuring people against all the people that they have helped. And that, I think, will make us better mentors. What do I think? I think for the mentees, you need mentors, and you need somebody that is going to help you. And you need mentors for life balance. You need mentors for research. You need clinical mentors, and it doesn't have to be the same person. And I think what has served me well is to just reach out to people. If people say no, big deal. Then you find somebody else, right? There's enough of us that will help you and mentor you. And for mentors, I think that mentoring people is part of leadership. I think that good leaders are good mentors, and also the way around. People that are not great leaders are not good mentors. And those are skills that can be, maybe if you're not born with them, it can be taught and cultivated. But I think it's a necessary thing. As a surgeon, we don't get training in leadership. We don't get training in mentoring. You're just placed in positions where you have to be a good leader and a good mentor. But those are necessary skills that we need to foster and we need to learn the same way that we learn to take a gallbladder out, right? So I think that, that's what I think about it.
And could you maybe share any memorable mentorship moments that stood out in your career, either as a mentee or a mentor?
Yeah, I give you as a mentee. So when I came to the United States, I had to work really, really hard to get a categorical spot. And at the first place where I came and rotated, they promised me one, but I was not smart enough, savvy enough to get bigger time. And May 26th, which was a Thursday, was very late because people match in March. But because they promised me a spot, I didn't participate in the match. And May 26th, which was a Thursday, at the time we didn't have the 80-hour work week. So I was exhausted, not sleep, still in the hospital at 6 p.m. The program director called me to his office and told me I didn't have the spot anymore. And so it was heart-wrenching for me, because if I don't have a spot, I don't have a visa. If I don't have a visa, I need to go back to my country. So it was very pressing. And I took the next day to interview in different places. And it was a couple of people that helped me. Mark DeMoya, who's a trauma surgeon right now in Milwaukee, he was my fellow at the time. And he gave me the day off so I could do this, so I could apply to places. And once I went to apply to places that were open, David Feliciano actually made calls for me, for those people to take me seriously, saying that I was good and I was clinically good and savvy and that I was a good person to have in the team. And I 100% believe, without a doubt, without those two people helping me at the moment that I had it, I would not have been here. I would not have been able to secure the spots. And I will be always forever grateful for them to lending me a hand. It's really easy to support somebody when they're doing well, right? When I didn't get the spot, there were people that now are my friends that at the time were like, oh, the spot maybe she wasn't that good, right? Because it's really easy to be friends and support people that are doing well. When you're passing through difficult times, those people are like, they run away. They're like, I don't know if I support you. So when you're going through difficult times, when those people support you, those people you need to keep in close proximity forever, because those people are real. They're real people that you need to keep close. And hopefully one day life will give you the opportunity to help them make difference.
Yeah, I think it's really important to have the real ones behind you that support you in everything that you want to pursue in your life. And you mentioned also that you had significant contributions to medical education in Latin America through your work with the Pan American Trauma Society. Can you also share more about the impact these programs have had on surgeons in that region and why it is so important to you to support global surgery in general?
So I think that, Pan American Trauma Society has a space for residents, for paramedics, for nurses, for surgeons. And I think that my connections with education in Latin America is not only with students, right? It's students that became residents, that become surgeons, that are still working in and trying to make a better place for everybody else. We have scholarships, we have traveling scholarships, we have case presentations, we have the Congress where you can send your abstract. We have plenty of opportunities to find a mentor and to become a mentor. And I think the leadership of the society in this aspect has been fundamental for a bunch of people's growth. There's a list of people that have grown in trauma.
Moreover, your research on trauma resuscitation has been widely recognized, especially your work with surgeon-performed ultrasound. And I wanted to ask what future advancements in trauma care are you most excited about, and what areas of research do you think will shape the next decade?
I think that's a great question. I think that, trauma care has changed significantly in the last decade. I'm really proud that the last decade, the beginning of my career, I did a lot of research in ultrasound, but not only ultrasound, but how ultrasound actually can be a dynamic tool to help resuscitation in trauma patients. And then lately, we have been, a group of us, pushing to rethink the ABCs of trauma and to prioritize circulation for people that are bleeding fast. And I think that that's going to be the future. The CPR, doing CPR and doing airway breathing circulation first came from the American Heart Association back in the 60s. And that was changed in 2008. But trauma is still, for some reason, behind. Even though the ACLS is coming with their recommendations, ABCs, that's only for external bleeding. So I think the future is going to be us recognizing that even for internal bleeding, we need to prioritize circulation first to allow those patients for a better chance at survival.
Yeah, that's really true. We know that you are a vocal advocate for equity, diversity, and also inclusion. In your experience, how can institutions better promote diversity within surgical fields? And what are the barriers that need to be addressed?
There's many barriers. I think that the way that we overcome these barriers is by working together, collaborating, finding people that can help you, and not only in the United States, but internationally, applying together for funding, finding innovative ways of having funding. So maybe the NIH and DOD won't have money, but then there's industry or there's philanthropy, and working with associations that can help you. But I think in general, there's plenty of barriers. It will take more than an hour to describe them, right? But the way of dealing with them is through collaboration.
And what advice would you offer to young women, particularly those from underrepresented backgrounds, who aspire to careers in surgery?
To not let anybody else dictate your future. People will give you advice, and maybe they do it with maybe they're doing it with the goodness of their hearts, right? Maybe they're doing it because they want you to do well. Some people won't. Some people will give you advice not with intention, but it doesn't matter the intention. What it matters is that they're giving you the advice from their own lens, right? So when they say, oh my God, that's impossible, they're not saying that's impossible for you. They're saying that would be impossible for me. And that's what you have to understand, right? Nobody knows what you can do except for you. Period and end. So some people are going to say, oh my God, impossible to have children and work as a surgeon. Maybe impossible for you, but not impossible for me. So you just have to find a way of doing it, right? And don't lose hope. I think there's always an opportunity. Where there's a will, there's a way. And I think, again, perseverance is key. When I looked at the people, and not only in surgery, but in life, when I looked at the people that are successful versus the people that are not successful, are the people that don't quit, that actually are the successful ones. The people that keep going in spite of everything, right? It's like, it's hard because you're sick. It's hard because you haven't slept. It's hard because, I don't know, you broke up with a boyfriend, or in my case, I had to go through a divorce, whatever the thing that is happening is hard. And in those moments that it's hard, it's the most important that you don't quit, right? Because when it's easier and you're successful, of course you're not going to quit. You get that dopamine surge, so you're going to keep going. But in the moments where it gets hard and when you feel that it's impossible, that's the most important time for you to go ahead and, buckle up and keep going.
Your words are really empowering. And as the second woman to serve as president of the Pan American Trauma Society and a mentor to countless women surgeons, what have been some of the challenges and rewards of breaking barriers in a male-dominated field?
I think that a bunch of barriers. That we just elected the president coming after me is a woman, and the next president is a woman. And the first comment that I got is like, oh my God, did you see how all the presidents in Pan America are women? And Paula is a feminist and he wants to change it all. And you know what? It scares people sometimes, right? And I just did my presidential address, and I just told a bunch of Latin American surgeons, that most of them are men, to stop being so much macho and to show vulnerability. And I thought, I was so nervous before, I thought I was going to be booed out of the stage. I wasn't. I think that they need to hear it. And I think what we need to recognize is like, yeah, we need to support more women, but we're not supporting women or the minorities because people that don't deserve it, right? Just because we want people with different genders, right? We want diversity, but we don't want diversity just because of a token. Just because of like, oh, we want diversity and we're going to hire somebody just to have our token or whatever. We want people, we have enough capable people that deserve those positions, can be in those positions without being just a token, right? We're going to have more women presidents of Pan American, as well as we're going to have more women presidents of all these trauma societies. And it's not because they're women, it's because they are surgeons that deserve it. And I think that that's how we have to change the mindset, right?
Yeah, you're right. You're totally right.
And think about it. We have more than 50% of surgeons are women, but there are not that many in leadership. That makes absolutely no sense, right? I think the world is changing, but we have to stop thinking, you got it because you're a woman, you got it because you're black, you got it because, no. I mean, you got it because you deserve it. And you're a woman, and you're this and that.
Yes, you're totally right. But how do you balance all the demands, all the surgical practice with your leadership roles and also your research activity?
Terribly. I don't think I'm a good person at balancing at all. I think I am very unbalanced. And that's fine. I love my life and that's what matters. So I don't even like this word balance, because balance implies that you're going to take something from here to keep the balance. And I don't. I am 100% at work when I have to be at work. I'm 100% with my family when I have to be with my family. Sometimes life happens and I'm mixing both up, but I'm giving it 100% all the time. And sometimes it works and sometimes it doesn't, and we figure it out.
I think it's normal. Yeah.
I think and we have to stop evilizing women for actually loving their job. right? Like it's a gender thing that you think like, oh, guys are okay to be are okay to be ambitious, right? But women, it's like a bad word to say you're ambitious. Oh, I'm a woman. I love what I do, and I make no apologies for it.
And if you could go back and give an advice to yourself as a young medical student or resident, what would it be?
To keep going,
To keep going.
and maybe to eat more chocolate. All right, guys, I'm being told by the hour I gotta go, but I hope this was good, and congratulations both. I'm really proud of both of you.
As we sign off, remember to stay curious, keep challenging yourself, and always aim higher. Thank you to all our listeners for tuning in this special episode. We hope it was as inspiring and insightful for you as it was for us. Your enthusiasm and engagement with these vital topics are what drive initiatives like this forward. We wish you a wonderful day and thank you once again for shaping the future of surgery together.